Hello, so nice to be here again, guys. And I'm so thankful for all of you ready to go. Hope you've all had a great weekend so far and that the day is ending well for all of you. Well, first of all, my name is Mana, as you know, and today I would like to tell you a little bit about Mana Handy Tips, why, what it is. Well, Mana Handy Tips is just a place where we can get some information on what happens to us as we age, the little troubles that we get here and there. But before we say more, I owe you to each one of you to apologize because hey Eva, it's nice to have you here today as usual. And as I was saying, I wanted to truly apologize to each one of you because of last Saturday. As you know, we had to put a notification on. Something came up as it happens in life and that we couldn't hold the live. So I truly apologize to each one of you. But here we are today. We're back on to talk a little bit more. But going back to Mana Handy Tips, it's just a place where you and I interact to talk about the little and big things that happen to us as we growing up, as we aging, and we encountering various conditions, various diseases that we don't control, but we can learn to manage naturally. So this is the place to talk about these things and giving each other some tips to go on about in lives, helping ourselves, our families, and also our dear loved ones everywhere, or even strangers. So it's the time to be here again. Hi, Sylvia. It's nice to have you too. Thanks for your support. Hello, Elizabeth. It's great to have all of you watching, supporting today, as usual. Thank you so much. So, anyway, here we are. This is number 4 of Mana Handy Tips. As we've discussed some things previously, so what have we talked about so far? We started discussing about degeneration and regeneration, and we've explained that this is a normal, natural process that occurs where we lose cells, but we're supposed to replenish to replace these, but that unfortunately it doesn't happen anymore, and we've explained the reasons why. And we'll be able to make these available for you if you want to concerning the degeneration and regeneration process. We've already talked about it. That was Mana Handy Tips number 1. Number 2, what was it? We talk about high blood pressure, which is one of the serious issues we encounter as we're growing old, as we're getting in age, and we're having various issues. And we seriously talk about it. We define words, we talk about the causes, we talk about what we can do to manage it better. And then, Mana Handy Tips number 3, that was about diabetes. Another serious consequence of the degeneration versus regeneration process that is not occurring properly anymore. And there we've given tips again, and we've talked about what to eat, what not to eat, and we've talked about lifestyle changes. So this is really informative where we inform about the conditions, and these are real things that happen in our lives or our loved ones' lives, and things that happen, but we don't always have the information about it, or we don't know about the little things we can do to kind of manage and do better in those areas. So today is Mana Handy Tips number 4. So as explained in the title, we said we're going to talk about shingles. So what are shingles? Well, simply put, it is some of you might not be familiar with it, right? But that's another consequence that we see as we getting in age, as we grow, and as we don't have that youthful vigor we used to have anymore. And unfortunately, many people have to deal with that, even here in our country. So let's talk about shingles. Let's chat some more about it. The reality is this, that as we age, we notice more outward signs of the passing years. Sometimes it's just wrinkles that we notice on the face, you know, laugh lines that are pronounced. We have gray hair. See, I got some. It's hidden right now, but I do have some too. And also, every time we need to read, for many, we have to pick up our reading glasses more frequently than we used to. These are all signs that something is going on in our body. And with age, we can also experience some health concerns. And that's the reason of being of Mana Handy Tips, where we exchange tips. Okay? And those concerns might not be visible, but if you're noticing concerning health symptoms, well, whether it's in yourselves or in someone you care for, well, these might be the signs of more serious issues like shingles that we're talking about today. So why don't we go about defining this word shingles? And how do we spell it? We spell it like this. S as in Sam, H as in help, I as in iceberg, N as in nanny, G as in goal, L as in Larry, E as in echo, S as in Sam. So that's Shingles, shingles. So it is a disease that affects your nerves. You and I know how important our nerves are, and that when they get damaged, every area the control in our body is in trouble. So our nerves are really important. We know that. And you may recall that when you were a child, you might have had chicken pox as a child. So shingles is remarkably similar to chicken pox that we had when we were little. So how about we talk about the symptoms of this disease? The most things that we can notice is pain. It is very painful. A kind of pain that will last about 2 to 4 weeks. Can you imagine? When we get in age, we can't handle things the way we used to anymore. So some kind of pain that you could handle better when you were younger, not so much when you're getting in age. So you can imagine having to be in pain for at least 2 to 4 weeks for someone getting in age. That's too much to handle, right? Hey, so nice to see you, dear coach Christian Adama. It's nice to have you here. And look who we have, Lydia Diarra, our new manager. It's great to have you too. Thanks for the support. And more coming. Hi, Alfred. It's nice to have you. Thanks to all of you to be here. It's really great. Well, let's get back to our subject. So we're talking about pain, the kind of pain that lasts weeks. And it can be shooting pain, tingling, or it can be accompanied by itching. Okay, or it can just be itching. That's the beginning of the symptoms of shingles. Okay, and it can be like a rash or blisters on your body. And you know what? This can occur anywhere on your body, but it often appears as a single stripe of sores or wounds that wraps around your chest or body, either the left or the right side of your chest. And it's very common in older adults, which makes it even more unbearable because, as mentioned, it's hard to handle pain as you get in age. It's not like when you were younger and you can handle things better. So these are some of the significant symptoms that you can notice about shingles. Now, let's talk about the causes because it comes from somewhere, right? Where is shingles from? What is causing it? Because when we know where something is coming from, then we can put measure in place to avoid it, to prevent it, if doable. However, the problem here is that it might be something you can prevent, but let's talk about the causes, okay? So, shingles is due to a weakened immune system. And even when we say you can't prevent it, well, we always have tips to be able to strengthen our immunity, okay? But as we grow in age, our immunity get weaker and weaker due to, and also other things, maybe stress or injury, certain medications. Medication do might help for something, but they may get you have shingles too. And there are also other factors like cell degeneration as we age. And that's the reason why we're talking about it after mentioning the other two we've discussed already. And this disease comes from the same virus that causes chickenpox. Remember, we mentioned at the beginning that it is remarkably similar. It's the same virus called the varicella zoster virus. These might be big words, but simple put, is the virus that causes shingles. So, how does it go? After you've had chickenpox as a child, the virus doesn't go away for some part, or for the most part, we should say. That virus lies inactive in nerve tissue near your spinal cord and brain. Now, the virus never left, it just became inactive after you had chickenpox. So now, years later, that virus may reactivate as shingles. Not everybody who has had chickenpox will develop shingles, but when it does happen, it is related. It is related to the chickenpox that you've had, and that virus never left your body. It was there, up there in the brain, inactive for some years, and then later it reactivates as shingles. So now we know the cause. Not much we can prevent about that per se at this point. So now, how about we talk about the consequences? Now, there are some consequences with shingles, even emotional, but some can be long term if left untreated, because we can recover from shingles, but if left untreated or if not properly handled, long term consequences can be there. And we don't want to have that. That's why we need to be informed. So, if your nerve fibers are damaged during an outbreak of shingles, what's going to happen? Damaged fiber can't send messages from your skin to your brain as they normally do. Instead, the messages become confused and exaggerated, and that's what's causing chronic, often excruciating pain that can last months or even years. Who want to live with pain? And if we have the information, we surely want to help ourselves and others regarding this disease. Because being in pain for a long time, and for someone who doesn't have the youthful vigor anymore, let's think seriously about it. What else? Now, depending on which nerves are affected during the time you had shingles, it can cause an inflammation of the brain. And that's what is called scientifically encephalitis, or simply put, infection or inflammation rather of the brain. It could cause facial paralysis or hearing or balance problems. See, this can be serious. Now, another long-term aftermath If shingles, wounds, and swellings are not properly treated, bacterial skin infections may develop, and this can be serious too. What else? Now, you imagine there's something even more that is coming, right? Let's talk about it. Another important and terrible long term consequence is what? Shingles may raise the risk of heart attack and stroke by 41%, the risk of stroke by 35% by itself, and the risk of heart attack by 59%. We're talking death here. Are we talking long term dependence, being paralyzed for life, living with terrible consequences? Let's face it. So, when you think about nerve damage, you think about quadriplegic, you think about things that are terrible. And that person won't be able, being old already, won't be able to take care of himself or herself anymore. And it's going to be a burden on family, a lot of things, a lot of money to be spent. But you can imagine what I'm trying to say. So shingles, although we can recover from it, even though you go through the pain, if left untreated or handled improperly, then the consequences can go really viral. So that's why it matters to know about it. Again, I want to thank all of you for being here today. It's great to know you support it, and it's great to know you getting the information so you can go and help others with it. Now, as I always say, we're not here just to make each other sad, feel terrible about the disease and how terrible it can affect us. We always want to talk about solutions, possible approach of solutions. So let's talk about that. Well, as I mentioned, shingles is not a life-threatening condition, but it can lead to one and is very painful. So, what can help? Well, vaccines. Right now we amid coronavirus and there's a lot of mass vaccination going on. Well, shingles, you can get a vaccine for that too. And that can help reduce the risk of shingles. Okay? So vaccination is important. And we don't want to wait to get the disease and suffer terrible before getting it. We want to think about our mothers, our fathers, our uncles, anyone close to us, or even strangers we know that are going in age and might have that disease, and it hurts terrible. I personally know someone who's currently suffering from it. And the worst is that it comes and goes because, yes, it can come back and that person is old enough. Okay. What else? Early treatment can help shorten the infection and lessen the chance of complications we're talking about. So it's pretty much having the vaccine or making sure that early treatment is in to make sure it doesn't get complicated. Now, we know Mana is not a physician. So, what are the tips about? Well, we're all aware of what we're supposed to do in terms of lifestyle changes, aren't we? Eating well, staying active, maintaining a healthy lifestyle, in addition to regular checkup. Remember, we talk about early treatment that can help shorten how much you're going to hurt. Yes. So if you have a regular checkup, you'll find out very early if you're heading to shingles. So you take action. What about food? There are some food that have been found to exacerbate, that make it worse, the shingle virus. And those type of food should be avoided where possible. Well, which food are we talking about? For example, food that has the amino acid arginine. So even when you're taking some supplement, make sure if you have shingles, it doesn't include the one that has arginine. Why? Because this type stimulate the virus to replicate and multiply. So instead of having just a few in your body, now you're going to have more. That means more trouble. So we will do well to eat better to avoid this type of foods during that time. So what are these? You'll be surprised what I'm going to mention. These are called healthy food usually, but they help the virus duplicate more and get worse. So we don't want to do that. Absolutely not. So what are these? Nuts, seeds, soy products, oats, coconut, flour, white or whole wheat flour. These, like I mentioned, are very healthy things we should be eating. We just want to be careful. If we know we have shingles, you avoid them so you can recover fast before you go back to them later. So it matters to know. Okay, so caution here. Now, sometimes all these we're talking about can be easier said than done. Avoiding, I love nuts. I love seeds because I know they're heavy. So I just know it's part of my daily intake. I just know if I'm have shingles, it's gonna be hard to stick, but you're gonna have to do it. So knowing is easier said than done. And despite our best effort, it's not always easy to contain everything. What else can help? I guess you've guessed it. Supplement. Okay, we have supplement that can strengthen your immune health, your immune system. Remember, one of the causes is a weakened immune system that can trigger shingles in you, especially if you've had chickenpox when you were a child, because the virus was in there all these years inactive. Okay, so strengthening our immune health by using supplement, and there are the best that I know and speak about often. And if you want to know more about it, please reach out. Mana Handy Tips on Facebook, and any questions you have, we'll be happy to help you strengthen your immune health. What else? Supplement again to do what? To fight infections. There are plenty of them, and we know the best. So please get to us if you want more information so we can get this to you. But again, giving the tips is what we're here for. If you want to know more, remember Mana Handy Tips on Facebook, and we'll be able to help you with natural product, and this does matter. So we heading to the end. What else can we say? Well, a couple things. Right here, hello, Queen K. Nice to have you know as well. Marika Mano. And hi, Martino. Nice to have you on as well. So, as we concluding, what else can we say? Are we saying that there are approximately 1 million estimated cases of shingles in the US in right here each year, please. So every single year we have about 1 million cases of shingles. So this is serious. And that's shocking because this statistic estimate that one out of every 3 people will develop shingles at some point in their life. And the elderly are particularly vulnerable, as we know already. But when we know that it's been proven that 1 out of 3 people may develop it, it will do well to learn more about it and to know it's pretty bad. I mentioned I do know someone that's having that issue, an elderly, and what happens often as we aging, we alone. Yeah. And when you going through that pain, it can be terrible. It's so nice having you, Zara. Thanks for your support. Get the information and go out there and help someone with it. So, knowing this, we want to take action without delay. So, please, today we've learned about what shingles, and we've learned about what it is, we've defined it, we've talked about the symptoms. How do you know you have it? We've talked about the cause or causes of it, and we've talked about the terrible consequences in addition to the pain that you feel for some time, at least 2 to 4 weeks. And if left untreated, we've also mentioned the terrible long-term effect it can have. And we don't want anyone to have to go through that. And we've mentioned what to do. We've given tips, and there are more that we can give. Just reach out to us, Mana Handy Tips, on Facebook, and we will be happy to assist in any way. Again, let's take action. Okay? Now we're going to consider just two things, and then that will be the end of our discussions today. Well, you may wonder, is shingles contagious? Why? Because remember the link it has with varicella? When chickenpox, when we were a child, we know that one is contagious. But what about shingles? Well, the good news is that it's not contagious. However, the disease itself is not contagious. However, still caution, because the virus is contagious. And when you have shingles, what happens? You can spread the virus to another person. You will not spread the disease that you have, but the virus is now reactivated in you, and that you can share. And when you do, that might cause the person getting it to develop chickenpox. That's how serious it is. That's why even though we don't wanna single out people who need help, but when someone has shingles, we'll do well. Even when we have to be around that person, we will do well to be very careful so we don't get the virus. So let's make it clear. Shingles by itself, the disease, is not contagious, but the virus is, and someone who has the disease can pass on the virus to someone who will develop chickenpox or varicella. And we know that's very painful as well. So that's good to know. That's another tip. So what else? We want to be careful. Not every rash on our body is shingles. So oftentimes it can happen that it's mistaken for another skin conditions such as hives, psoriasis, or even eczema, you know. And even in that case, like mentioned, the supplements are very helpful. Okay, that's why if you suspect this might be shingles, take action. Go to the doctor, consult the doctor so it can be confirmed and action be taken without delay. Because if left untreated, shingles, of course, gonna have terrible consequences, even stroke. So we wanna be careful and protect our loved ones and ourselves. So I think we coming to the end here. And yes, Mana Handy Tips number 4 was today. And what have we talked about? Shingles. Why have we talked about it? Because we provide, thanks, Martina. Why do we talk about it? Okay, we have a question here. How about we answer that? Martina want to know, how do you prevent to spread the virus and how to treat it? Well, I realize you just getting us. We mentioned vaccination or early treatment, and it's gonna go with is a kind of infection. And we don't want to go in detail with the medicine doctors use. However, we've talked about the supplements that can help, and these are the supplements for immune health to strengthen and also fight infection. And if you like more information, Mana Handy Tips in Facebook, and we can communicate and we'll provide more information. Why? Because right here is just informative and talking about it, but we are not doing more here. So I'll be happy, Martino, to give you more information via Mana Handy Tips and provide you specific supplement that can treat that. Otherwise, the doctors have their means of treating it. But what matters is that it can be detected very early and tackled down. Because if left untreated, the consequences can be really, really terrible. And we don't want to do that. So vaccination and early detection and treatment by the doctor, yes, but also by natural product that we know about and will be very happy to provide in Mana Handy Tips. Okay, so again, we were wrapping it up. It's really important that we informed about shingles. It can happen to any one of us. Why? Like myself, I know I don't remember for sure. Hi, Natalie. Thanks so much. Thanks so much for your compliment and thanks for your support. Like myself, I know being born, especially originally from Togo, I know I might have had chicken pox. Well, I can still ask my mom, but it is common. So, which means that that virus, the varicella virus, right now might be somewhere. It not even right might be, but it is inactive by the brain and could be reactivated. Why? Because as you're growing in age, your immune system is getting weaker and weaker. And that's when the virus is able to get reactivated and then it turns into shingles. But there is hope, okay? And there are solutions. And what I advocate personally is supplement that I know of value that have proven themselves. Okay, and that's the natural way I know of. But it's important to confirm the diagnosis as soon as possible because it can be very, very painful. So I hope we've answered you, sir. And yes, it can be treated in the medicine, but also natural. And I'll be happy to provide the specific supplement that help with this via Mana Handy Tips. Otherwise, I will say thank you to each and every one of you for being here with us today. Yes, you know, as we age, there's a lot of issues that we develop. So we've talked about high blood pressure, diabetes, and today we've discussed shingles. That might be a surprise to some. You might not be used to it. Hi, hi. How are you, Renee? It's nice to have you on the show too. So, I only got to know about shingles because, as I mentioned, a dear friend, an older friend, is battling with that. And what is worse, in her case, it is recurrent. Why? Because her immune system it has weakened. That's how I got to know it. So we're working on helping this person with natural product, and we'd love to help you as well if you want to avail yourself of it, of the natural solutions and supplement that we have in store. So I thank each one of you for being here today. Shingles is important to know about it. Even though we might not be too old yet, we're heading there. So we want to be prepared. You want to take whatever is necessary and the best we know to strengthen our immune system, to know how to fight infection naturally, preferably, and then we'll go from there. So in a week, what's gonna happen? We'll be together again with Mana Handy Tips, informing about something that is happening in a community as we age and even with younger ones. Okay, but it's just that currently our special population we concerned about is the most vulnerable ones, which are as you aging. Okay, but we'll be here again next Saturday to talk more. And I'm not saying yet, but you get to know what we're gonna discuss next time. Okay, and also if you happen to get on this slide later, okay, you can just subscribe to Mana Handy Tips. Okay, so you always be aware when a live is coming on and you get to know the topics. So don't forget, subscribe to Mana Handy Tips, the place where many tips are exchanged because we need information to know how to handle and manage the issues we have, the challenges we encounter as we grow in age, or as even for younger ones. So again, I thank each one for listening in today. And please remember to subscribe and go for more information. And I'll be right here next Saturday again to discuss about other things. And should you want more information, remember, Mana Handy Tips on Facebook. So until then, enjoy the rest of the evening with your family. And I long to see you next week. Until then, stay safe. Thanks for your attention today. Bye bye.